Hi, I'm Dr. Prashanth Mukka, consultant pulmonologist, Citizen Specialty Hospitals, Hyderabad. Can you have tuberculosis without cough? Yes, you can have tuberculosis without cough. Especially in early stages, cough might not be the presenting symptoms and only might present with symptoms like fatigue, fever, night sweats, and weight loss. And also in certain forms of tuberculosis, the cough might not be the predominant symptoms like latent TB, where bacteria are present in the body but are inactive. And in extrapulmonary tuberculosis, the TB can affect other parts of the body but often don't present as cough. In miliary TB also, which is a rare but a serious form of TB that spreads through bloodstream and may not have cough. If you suspect tuberculosis without cough, it is always important to get tested, and especially if you have risk factors and symptoms of unexplained fever, weight loss, night sweats, and fatigue. Can tuberculosis spread through sharing food and utensils? No, tuberculosis does not spread through sharing food, utensils, or drinks. Tuberculosis bacteria can spread through air when you're in close, prolonged contact with someone who has active, untreated tuberculosis and presents with cough, sneezes, speaks, or sings, releasing tiny droplets, and that others can inhale, can spread tuberculosis. Can TB affect other parts of the body beside lungs? Yes, tuberculosis can affect parts of the body other than the lungs. This form of TB is called extrapulmonary tuberculosis. Tubercle bacilli can spread through the bloodstream or lymphatic system to other organs. If it involves the lymph nodes, it is called tuberculous lymphadenitis. If it affects the spine or joints, it is called Pott's disease. If it affects membranes around the brain, it is called meningeal tuberculosis. If it affects the intestines, liver, or peritoneum, it's called abdominal tuberculosis. If it affects the kidneys, bladder, or reproductive organs, it is called genitourinary tuberculosis. If the bacilli spread through the bloodstream affecting multiple organs, it is called miliary tuberculosis. Most forms of extrapulmonary tuberculosis are not contagious unless the bacteria affects the lungs. Can TB make someone infertile? Yes, tuberculosis can cause infertility, especially if it affects the reproductive organs. This is known as genital tuberculosis, a form of extrapulmonary tuberculosis. In women, it causes fallopian tube blockage, preventing the egg from meeting the sperm. It can cause uterine damage, making the implantation difficult. It can cause hormonal imbalance, which disrupts menstruation and ovulation. It can cause pelvic adhesion, making conception itself difficult. In men, infection of testis or epididymis blocks the sperm transport. It can also affect the sperm production and also ejaculation, which will lead to infertility.